Welcome back. COVID vaccinations have ramped up to 2 million a day at the end of last week, and the Biden administration is securing 200 million more doses of the Pfizer and Moderna vaccines. Despite that, though, there's still growing frustration over the lack of vaccine supply to meet demand, particularly in this moment. At the same time, parents are desperate to get their kids back in the classroom, and the CDC has issued new guidelines for operating schools during the pandemic. Joining me now is the new director of the CDC, Rochelle Walensky. Dr. Walensky, welcome to Meet the Press. And before I get into the school guidelines, I want to ask you about a report out of the UK that indicates this UK variant, not just potentially more contagious, but potentially more deadly. And this is obviously the variant that officials like yourself fear could be the dominant strain in this country. How concerned are you that we're up against another dark period?
Good morning, Chuck. Thanks for having me. I think we have to watch this very, very carefully. We've known now that this B.1.1.7 variant, the variant that came from the UK, we have over 1,000 cases here in the United States in over 39 states. We know the early data have demonstrated that it is around 40 to 50% more transmissible. Already that means we're likely to have more cases and more deaths from this. And now these early data that have come from a prior set of early data have suggested that there might in fact be increased morbidity and mortality. All of it is really wraps up into we can't let our guard down. We have to continue wearing masks. We have to continue with our current mitigation measures. And we have to continue getting vaccinated as soon as that vaccine is available to us.
All right, let's talk about the school guidelines. And there's some folks that are wondering how much politics may have gotten involved or how much the White House may have gotten involved. Because last week the White House walked back some comments of yours about teacher vaccinations. And you were saying that they were not necessary in order to open schools. The White House said you were speaking in your personal capacity. How should we? Are you speaking here as the head of the CDC or in your personal capacity? And should people see a difference?
I'm speaking as the head of the CDC. I believe that that's why you have me here today. Our guidance has now been released. It was released on Friday, and it specifically articulates the 5 key mitigation strategies that we need to keep our schools open and other layered mitigation strategies, including teacher vaccination, that are not essential to get our schools open, but we do recommend.
What are some of the flexibilities in your guidelines? And I say this, you say you want to have 6 feet. There are some schools that say, look, can we do 3 feet? Everybody will wear masks. Can we do 3 feet, particularly for elementary schools? What would the CDC say?
You know, our guidance is really dependent on how much disease is in the community. We know that most of the disease that comes into the school comes into the community. And with universal mask wearing, we know that there's very limited transmission within the schools, and that transmission is largely from staff to staff, and largely when those mask wearing is breached. So we are more flexible with the 6 feet if there's limited amount of community spread in those low to moderate ranges. When you get to substantial and high ranges of community spread, we really feel like you need 6 feet. The data suggests, the science suggests you need 6 feet with universal mask wearing to keep our children and our staff safe.
We are getting close to, I think, about 15 to 20 million Americans this week will have gotten their second dose of the vaccine. What is the guidance for a vaccinated, fully vaccinated American? What is the travel guidance? What is the mask guidance? What is their work guidance?
Really great question. I'm proud to say as of yesterday, we hit the 50 million vaccinations into arms mark. So we are scaling up. We don't have a lot of data yet to inform exactly the question that you're asking. We have issued guidance this week that recommends that if you have been vaccinated and you are exposed, and you're exposed within 3 months of your vaccination, that's similar to if you'd been exposed within 3 months of disease, that you need not quarantine. As data emerge on many of the questions that you're asking, we will update our guidance in real time.
We're seeing a lot of states. We've just had a dip these last 2 weeks. It felt like the first week where we took 2 steps forward and 1 step back rather than 1 and 2 back. But a lot of states are getting rid of their mask mandates already. Is it too early to be doing that?
Absolutely. We are still at about 100,000 cases a day. We are still at around 1,500 to 3,500 deaths per day. The cases are more than 2.5-fold times what we saw over the summer. It's encouraging to see these trends coming down, but they're coming down from an extraordinarily high place. And as I said earlier, if we want to get our children back to school, and I believe we all do, it all depends on how much community spread is out there. We need to all take responsibility to decrease that community spread, including mask wearing, so that we can get our kids and our society back.
And including mask wearing well. I'm very glad that you guys gave a little bit of a lesson on that. I know people will go to your website to get more lessons about that as well. Dr. Walensky, it's been a year. We didn't ever got the head of the CDC for the last year. It's nice to have the head of the CDC on Meet the Press. Thank you very much.
Great to be with you. Thank you.
Make sure to check out our interactive state-by-state guide to figure out when and where you can receive your COVID vaccine. Visit planyourvaccine.com to learn more. Hey, thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.